Okay, so day 2 of Diabetes Awareness Month. Yesterday I did a little intro and today I'm doing my pump change. So we have our pump. I'm currently actually in low blood sugar at the moment. Yes, I am, but I'm still doing the pump change. I've taken some sugar. So first of all, on this, we're going to go ahead and we're going to say new reservoir. So when we click that, it then starts to rewind the piston inside the pump. While that's rewinding, I can show you my insulin and we can fill our reservoir. So I use NovaRapid insulin. Comes in a vial like this when you use a pump. You can get pens if you're type 1 diabetic. I did pens for 17 years and this is about a year and a half on the pump. I have this much insulin left. This is my reservoir. So it looks like this, and what we're going to do is we're going to pull back the syringe kind of part of it here. For 3 days, this will do me how much insulin I need. So I kind of have about 1.5 because I don't want to overfill it and waste insulin, because you have to change it after 3 days or there's a risk of infection. So we're going to clip that on, push out the air, and we're going to put that's ready to go. So we want to make sure that we get rid of any air bubbles. I think this one's actually good. I don't see any air bubbles. This is obviously a short. If you want to see a full-length video on that, I've loads on my YouTube channel, Diabetic, or you can ask me questions and I can do another video on whatever you want to see. So that's ready to go. We want to get our line. Inside here we have 2 parts. We have the cannula that's going to go onto my body to attach everything to, and then we have this line. So just take off just a little bit of paper. Here is the line. You want the cap with the needle on there, because what we're going to do is we're going to get our reservoir. We're going to attach the cap on there till it clicks. On the pump, it does give you instructions. So you go next, and then we're going to put in our reservoir. Remember, we rewinded it so our piston is ready to go. And now what the pump wants to do is we just hold here and it's going to start to load it. So it's going to bring the piston right up to where the level of insulin is on the reservoir. And if you're new to this, if you've never seen this before, I do this every 3 days usually, or sometimes every 2 days if I run out of insulin. Okay, that's ready to go. So now we have our line. We unclip our cap that it comes with. And what we want to do here is we're going to fill the line with insulin. So on the pump, I'm just going to press fill, and it's going to take a few seconds. Usually for me, I always go for stomach site, and I always match up to whatever side my sensor's on. So sensor's on the right, that means we're going to put this on the right as well. And if you're new, you see these arrows here, that's the direction that the part you clip in is going to be. Now we just get the pump. We have our thing here. We clip it in. That's all clipped. I'm all attached up, and all I have to do on here is fill the line. So I fill with 0.6 units of insulin. So it just brings it right up to the top, and it means that when you take your actual insulin, it's at the very top and it's ready to go and you don't miss a little bit of bolus. So that's me all hooked up, and I'll usually wear it in the pocket if I have one on the right hand side, or clip it into the bra.